you all for coming today. I'm really, truly impressed with the turnout. I'm also impressed with what Karen and her team have done to bring our previous two speakers, who were awesome. They really set the stage for what I'm going to talk about today, and that's having the conversation and giving the gift. As I look out there, I see a bunch of Coloradans. Coming from Maryland, what do I think of when I think of people in Colorado? Any idea? No, I don't think of cowboys and Indians, but I think of you as independent souls. People who have an opinion, people who want to have power over their life and what they do, people who don't want somebody else making decisions for them. You see where this is leading. That's why advanced care planning is so important for people like you. You want to have a say of what's going to happen to you and for you when you no longer can speak for yourself. It's that independent Colorado spirit, and you don't want strangers making decisions for you. Why me? And Karen mentioned a couple things about my background that generate a reason for me to be here. But I'm also an advisor to Aging with Dignity and the 5 Wishes. How many people have heard of the 5 Wishes? Not surprising. Sangre de Cristo uses the 5 Wishes as a tool, much like the Colorado form that Jennifer talked about. It is another form that can be used instead of the Colorado form. If you go to the internet and you look up for advanced directives, you'll find lots of forms out there. But they're going to have all the things that Jennifer talked about today at some point along the way. And Aging with Dignity was developed in 1990. Slide. In the 1990s, Aging with Dignity came into being. It was started by Jim Toohey. Jim Toohey is probably someone you've never met, or even heard of. But Jim used to be the legal counsel to Mother Teresa. And while he was working with Mother Teresa, he learned that the medical legal activities that he'd done in helping people fill out their forms was not the only thing he needed to be thinking about. It was advocacy for the patient on a personal level, much like what Dan talked about earlier, taking care of people and finding out what is important to them and nurturing their personal side as well as their medical side. So he put this organization together. It's a nonprofit, and its president is Paul Malley. And I mentioned Paul because Paul's the reason I'm here today. As an advisor to Aging with Dignity, I am available to them to speak at presentations like this. And Paul got the call from probably Ellen or Phil Kittle. And Phil had heard him speak 10 years prior. And Phil thought he liked the way that Aging with Dignity and the 5 Wishes supported the individual and helped have that conversation. And he felt that was an important piece of what you needed to hear today. And therefore, here I am. You also heard I was in the Navy. I'm going to tell a little Navy story as well. How many former military people do we have in the audience? Thank you. Thank you for your service. But the reason that I got into this wasn't because I was in the Navy doing educational programs. It wasn't because of Paul Malley. It was because of my mom. When I was 20 years old, unlike Jennifer's son, I'd never heard of any of this stuff before. I was about 20, and my mother said, "Jane, I'd like you to sit down and talk to me." Ooh, that's always a worrisome sign when mom sits you down to talk to you. And I said, "Okay, what are we talking about?" She said, "I have something very important to tell you and to talk to you about." She didn't use the term conversation like we do today, but it was basically the conversation. And she said, "I've written this down, and I want you to know what I want if I can no longer speak for myself. If something untoward happens, I get hit by a car, I get cancer, I have some other disease, I want you to know what I want. And she had it listed. She was very clear in her desires. And she said, also, I've spoken with your dad, and I've talked to your two brothers. Well, my two brothers were significantly older than me. They were in their 30s by that time, and I'm sitting here, well, she's had a conversation with them. What am I involved here for? She said, I want you to be my surrogate and make those decisions for me when I can no longer speak for myself. Whoa. Now, Kid's sister is now in charge. That took me back a little bit, but we had more conversations about it, and conversations with my dad, and I was ever so grateful to have had those conversations, because when I was called upon, much like Dan's dad, who's had a stroke, my mom also had a stroke, and my father showed up at the hospital with her living will and her durable power of attorney. And in those days, they looked at it and they said, what's this? We've come a long way from that. Now, as you learned from Jennifer, hospitals, when you're admitted, ask you if you have one or encourage you to fill one out if you don't. Back then, that didn't happen so much. There was a lot about my mom's care that needed an advocate during that time frame, and so that's what I became. Now, I was one of those a little farther away advocates. I wasn't in the same town as my mom, and it does provide complications, but it's not an impossible thing to do. So if you've got your best bosom buddy who you really want to make your durable power of attorney for healthcare, don't just throw that idea out the window because they happen to live a couple counties away or even a couple states away, as long as they're committed to come help you when you need it. And that's the bottom line to that. Mom had been an independent soul. She'd been orphaned at the age of 8. She'd had to be in charge of her life. And because of that, she felt it important to be in charge of the end of her life as well. So I was going to ask why today, but I think we've been over National Healthcare Decisions Day a little bit already. It was started 6 years ago, and what I'll tell you is it's called National Healthcare Decisions Day because it started here in America. But that's not where it is today. It's not only in America, but as you'll see by the next presentation video, it's also in Canada. They have an organization called Speak Up, and it's an opportunity for people to speak up about what it is they want at the end of their lives. This time last year, I was speaking about National Healthcare Decisions Day in Singapore. People all over the world are getting involved in this movement to have the conversation and to give the gift to your family. And truly, my mother's sitting me down at 20 and having that conversation was a gift, because I know that I did the very best things that I could for her when she couldn't make her own decisions. I'm not sure what I would have done had I not had her wishes very clearly impressed upon me at that age, because you're really second-guessing at that point in time. You've heard a lot of reasons today about why you should care, and most people want to live as long as they can, as well as they can. It's not about what you don't want. It's about what you do want. What do you want to live like, and how do you want to live when you can no longer speak for yourself and someone else needs to make those decisions? It's why the conversation is so very important. It puts you back in control to a certain extent when you don't have any control, and allows other people to make decisions for you based on you and your values, your background, your experiences, and your desires. Jennifer mentioned the process today, and I'm going to give you a definition of an advanced care planning and what it really is to another part of the world, and that's Australia. Robin Brogan is a physician in Australia, And she defines advanced care planning as a process to ensure that an individual's choices are respected for future medical treatments, and their beliefs, preferences, values, and decisions are made known to their families, their caregivers, and their healthcare professionals. And I want to emphasize the healthcare professionals. Now, we've talked a lot about family and having the conversation and doing it with your family, but it's important that you bring in people like your pastor. If you are affiliated with a religious organization, bring in your physician. I cannot tell you how much I appreciated the comment from the back of the room about, I can't get in to see my physician. It is a chronic problem, and it is something that needs to be corrected, because you do feel like you get in the short shrift when you get that kind of, I've got 5 minutes, get it all out or nothing. And it's why people like me end up doing the job that I'm doing. I go in and have these conversations one-on-one with people and then bring in their family. Because of my background and having had that wonderful, rather startling conversation with my mother, why I do what I do. It's always enlightening. It's always not what I expected. One of the things that people in this country can't seem to talk about, as you've all mentioned, is death. Nobody wants to use the word, let alone talk about it. I mean, when you see and hear that someone has died, do you hear people say they died? They went to the great beyond. They passed away. There's all sorts of colloquial phrases that are used, so we don't have to use that word. Okay? People don't want to talk about death. This isn't about death alone. This is about life and how you want to live it. Historically, these planning activities that went on were very medical, legal. Now they're much more about you as a person and what you want and how you want to live as part of the medical legal document. And it's why lawyers got involved. And, bless them. They're one of the reasons we have as many advanced care plans, or at least living wills and durable powers of attorney, as we have, because they've included in their trust packages. And as Dan noted, and I will show you later, it doesn't really work so well sometimes. And again, it's not necessarily the lawyer's fault, and some of them have become absolutely spectacular at having the conversation. Those I find are few and far between, but they're out there. Let me talk to you about Mrs. O'Leary. Mrs. O'Leary was a patient of mine, and she had given the gift, but her son never realized it. She was in a terminal state. She was, as we frequently refer to colloquial in the medical world, she had the dwindles. She was getting sicker and sicker, and there was very little we could do to help her out. While she was still awake and alert, we had asked her, "Would you like a feeding tube?" And she said, "Absolutely not." Question answered. She actually had a living will that said she had no intention of having a feeding tube. Well, as frequently will happen in our dysfunctional American families, son shows up. The first thing he says is my mother eating?" She no longer could speak for herself, and so we explained that no, she wasn't. "Well, she needs a feeding tube. You've got to put a feeding tube down her." And we said, "Why?" "Well, she'd want that." We reverted to having a conversation with him about advanced directives, and we pulled out her living will. This man's demeanor changed dramatically. From a frantic son who had come all the way across the country to have a few moments with his mother before she died, who was really concerned that he might be killing mom if he didn't put a feeding tube in her, to someone who said, "Oh, I didn't know that's what she wanted. Thank you." She had given him the gift, and that gift made a significant difference in his day and truly in hers, because she had her will and her preferences taken care of. The first thing you have to do, and we've referenced this before, is to have the conversation with yourself. What is it that's important to you? How do you want to live the rest of your life? What are your beliefs? I don't know if anyone here cares, but some people really have a fetish about whether their feet are inside the covers or outside the covers when they sleep at night. If you care about that, it's something that your caregivers would like to know about. Because we as caregivers will do what we can to meet your needs. Most of us, when we're at the bedside, nurses at the bedside really, really want to make a difference. They really, really want to do what you want them to do. And they really want you to get better. But we will do what makes sense to us if you haven't communicated that to us. It's one of the beauties of the 5 wishes. You can write these things down. You can tell us what's important to you. Inside the covers, outside the covers. I can't imagine how angry, I have a friend who had told me just how angry she would get if someone tried to give her a massage, which frequently is something nurses do in hospitals or in nursing homes. We think it's comforting and relaxing. If you don't like a massage, it isn't. Talking about where they wanted to live their lives, what they wanted to do in the future, the girls they wanted to date. You know, they talked about a lot of things. And one day, his friend said to him, he said, you know, my grandfather's been sick and I've seen him on these ventilators and all this equipment and stuff. He said, if anything bad ever happens to me, make sure nobody does that to me. I really don't, if I don't have, as Jennifer said, that brain still working and I'm not able to make decisions for myself, and you know, it's okay if you do it for a little while, but don't let me linger on that. Well, Matthew took that in, and life went on, and this young lad got a motorcycle. Well, you Independence, Colorado souls have motorcycles, and you don't have as many trees as perhaps this young lad did, but he ran into a tree. And he ended up in the ICU on all sorts of life support for over 2 years. And nothing Matthew could do could help his family understand that Matthew knew what this young lad wanted. He knew that he would not have wanted to live like this, but it was too hard. So they'd had the conversation, but they hadn't done the next part, which is the documentation. You've got to do both of them, because both of them are extremely important. The living will and the durable power of attorney are the 2 documents that I'm going to speak to. The most and the pulse and all of those, I leave to other discussions, and Jennifer and Dan have both referred to them. But what I'm talking about is the basic advanced care planning activities, the ones that happen from age 18 up. And why at 18? Because motorcycles exist. Okay? Because people on the Beltway in Washington, D.C. don't always know if they're coming home at night. And sometimes would be better off if they didn't make it to the hospital than they are when they do, because things are done to them that they may not have wanted done. And if they don't have it in writing, our medical society organization is here to make us better, to get us well. And they're very frustrated when they can't. And given the path of least resistance, they'll do everything in their power to do what they can to keep you alive. The quality of the life is what we have to be concerned about. And that's where having these plans in place will help. Now, don't think if you go to an ER and you come in with a document like the Colorado document that has all the stuff on it, that you walk in, you come in via an emergency ambulance, they're going to take care of you. They're going to do what, if they see a bracelet, they may not do CPR, but if you're transported to an emergency room, that's your job, is to do that work. So don't get frustrated if you run into occasions where that might happen. that documentation, whether it's a wallet card, or the bands and things that we've talked about, are very important. But the documented power of attorney is not enough. Much like the conversation alone wasn't enough. The documented power of attorney is also not enough. And here's where we get back to the lawyers again. I had a patient at Bethesda whose name was Joe. Joe was a retired Marine. He'd sort of had a good life. He had multiple medical problems. I had never had the opportunity to talk with Joe. He was a patient of mine, but I had never had a conversation. He had no family. No one visited him. But when they brought his things from the nursing home, they brought with it his durable power of attorney for health care, in which it identified Fred Thompson. Fred was a guy who I immediately latched on to the fact that there was a durable power of attorney. And so many times in a hospital saying we don't see them, people don't have them. And we just talked about the fact that around 75% of people don't have these documents. So I was thrilled that Joe had one. So I picked the phone up and I got a hold of Fred. The phone number actually worked. And I said, Fred, and I explained to him who I was, where I was, and then I had Joe with me. And I said, do you remember Joe? And he goes, Joe. Oh yeah, Joe was my neighbor 30 years ago out in Washington State. He said, how's he doing? Oh, it's like cold ice to your heart. I said, did you know that Joe had written your name down as being his durable power of attorney for health care, should he not be able to speak? There was a long pause. And Frank said, he did what? He never told me. And he said, he needs help? I don't know what he wants medically. I haven't got a clue. Well, needless to say, that document was expertly executed in terms of the paperwork, but not in terms of the intent of the document. It had been filled out by a very pricey, high-end law firm that basically, we found out later, asked Joe who he wanted to be his durable power of attorney. And he named Fred. He never talked to him. He never asked him. He never shared his beliefs and what he wanted. He had done none of those things. It had been done in the law office and completed, and X in the block, never looked at for 30 years. Don't do that. It's not helpful to your family. It's also not helpful to you. Remember, these documents are being filled out to help 3 different groups of people. 1, you. We can care for you much better in the hospital or in a nursing home when we know you a little bit better. There's nothing nicer when I walk into a room of a new patient who I know cannot communicate with me, and there's a 5 wishes document there. Because it tells me a little bit more about you, the soul of you, what it is that's important to you. And I can read that at my leisure and get a little bit of an insight into who you are and what makes you tick and what's important to you. Without that, you are another patient. I will care for you as best I can, but I can do so much of a better job. So it's important to you because you get enhanced, better care. It's important to your family that it's completed because that's the gift whereby people who would be bearing a huge amount of guilt if they had to make decisions for you without knowing. I know Jennifer, and I think Dan mentioned also, people say, oh, my kids, they know exactly what I want. Not a problem. We don't have to have this conversation. It's just, they know me. They'll figure it out. Oh, please don't do that to them. The burden, as with Mr. O'Leary, of having to make decisions when you don't have a clue is an onerous experience, and it's not just a one-time experience. These people go on through life wondering, gosh, did I do the right thing by my mom? Should have I done something different? Gee, we left her on life support an awful long time. Should I have done that? And it doesn't end. It's why there's so much depression in people after their loved one dies, when they haven't had the conversation. So having the conversation is good for them as well. And as I mentioned earlier, it's also good for us as healthcare providers, because we can give better care to you at that point. I mentioned earlier the 5 wishes. They're up on the wall. Basically, it starts with who you want to make the decisions for you. That's the durable power of attorney, the healthcare proxy, the medical advance. There's so many names for them. It goes on and on. So don't be lured by the names. It's the person you want to make decisions for you if you can no longer make them for yourself. And then there's the kind of treatment that you want. We talked a little bit about CPR, and we talked a little bit about feeding tubes and other types of things. This is your chance to put down those things that are meaningful to you. And I think Dan said, don't make it too prescriptive or limiting. The most important piece is the conversation and the next 3 that talk more about you personally and what's important to you. How comfortable do you want to be? I want to tell you, I asked a patient who is a dependent mother who came from a foreign country. I said, I'm coming in to give you your pain meds. She said, I don't want them. Hey, I have rarely found a patient who doesn't want something to cure their pain. And I said, well, why not? She said, I'm getting ready to die. She said, and in my religion, in my faith, in my culture, having the pain is what you need to have in order to get to the other side. Whoa. I wasn't expecting that. So you need to understand your people and your clients better, because sometimes what you perceive as being important is not what they perceive as being important. It's not their genre. And in today's age, where we have people from all over the world in this country, some people have different ways of looking at things, and that's fine. And that's the importance of the document. It's what you want. It doesn't mean I don't want anything. It doesn't mean I want everything. It means to be prescriptive and say what is important to you. How do you want people to treat you? That's the inside of the covers and outside of the covers, the massage. Play the music, don't play the music. Have the pet therapy dog come in, don't have the pet therapy dog come in. I mean, these are things that each one of you has your own personalities and your own persnicketynesses that you may or may not be important to you. This is a place where you can put it. And then it gives you the chance to talk about the things you want your loved ones to know. It can be everything from I want such and such a song sung at my funeral to I want to be cremated, I want my organs donated, or anything else that may come to mind. It's an open flow area so that you can speak to those things that are important to you, that you want your family to know. We've talked about reviewing these periodically, which is important. I like the idea of doing it every year. I'm not naive enough to think that everybody in this room is going to review it every year. But certainly as life activities change, it's important. Particularly in Colorado, many of the other states don't have the ruling that if you get divorced, the person you had down was your spouse is automatically removed. Sometimes that isn't necessary, and sometimes it's very necessary. But it's certainly another way of reviewing. Gives you an opportunity to review, and they can be changed. I know that was one of the questions we got. Can the documents be changed? And the answer is yeah, anytime you want. You don't have to live with it as it is. You can change it tomorrow. You just need to make sure you date it. And yes, it needs if you're doing the 5 wishes, it requires that you have 2 witnesses, because that helps meet the state requirements. And It requires notary in 4 different states, none of them near here. I can't remember all the 4 right now. I know North Carolina is one. But other states, like Colorado, do not need to be notarized. They just need the 2 witnesses who aren't relatives, aren't going to benefit from your death, aren't going to be caring for you, so it can't be your healthcare providers. And so these things are some of the questions that have come up. The 5 wishes are honored on their own, totally on their own, once witnessed in 42 of the 50 states and the District of Columbia. Colorado is one of those states. The other states will allow you to use the 5 wishes, provided you add one of their state forms. Keeps their hand in the till, I think. But they have to add one of their state forms to it. And as I say, each state is different. But the nice part of having the portability of it is the use across different states. Folks are pretty, in the healthcare world, are pretty open about, if you have a living will and a durable power of attorney in another state, man, that's fine with me when I'm taking care of a patient. It gives me more of a perspective. I mean, considering how many people don't have it at all, if you find someone who does, like Joe, it is gold to you. So, now, what are you going to do next? Today's your day. Today's the day you're thinking about it. I can't tell you how many conferences I've gone to and lectures I've gone to where I've had great intentions. I got little notes. Make sure you do this. Make sure you check this website out. Please don't let those run fallow come tomorrow or the day after. Have the conversation with your family after you've had it with yourself and fill out these forms. You have a plethora of organizations here in the Pueblo area who are more than available to you to help you fill these forms out. Don't let the fact that you can't get to your healthcare provider for long enough to meet your needs be a deterrent. These folks are here to help you. I know if you're attached with Sangre de Cristo already, go ahead and talk to your social worker. If in fact you aren't, hit the next slide. Done. Yeah. That's right. Here's the phone number to call. They're more than willing.
Just so you know, it was the nursing home actually, so I wasn't not paying attention.
Yeah. Somebody needed him. So feel free to call them. They're available to get you the 5 wishes, and there's 5 wishes over on their table today. There are pros and cons for every document that's out there on the web. I mean, there are lots of them out there, and the fact that you fill one out is what's important. Which one you fill out needs to be met with what your state's requirements are, and that's very well described in what you have in your packet, and what your personal desires are. So, thank you very much.